Kenya is on high alert over the resurgence of deadly diseases in the region, with the Ministry of Health now advocating for heightened surveillance across all border posts. This comes as 3 new cases of Monkey POX have been reported in the country, bringing the total cases reported so far to 41 since the outbreak in July 2024.
Speaking at the Jomo Kenyatta International Airport in Nairobi, Public Health Principal Secretary Mary Muthoni expressed concern over the outbreak of diseases such as Marburg and Ebola in neighboring countries.
These 2 outbreaks remain active, and given our proximity and frequent cross-border movement, Kenya remains at high risk of importation, requiring urgent and coordinated action to mitigate the spread of these 2 diseases.
With Kenya remaining vulnerable due to shared borders, the PS said that surveillance has been heightened at all entry points.
Every passenger who is coming into Kenya right now is going through screening. And please let us collaborate with the agencies so that we are able to prevent ourselves from any impending risk that may be coming to this country.
This is a perfect opportunity to reiterate WHO's commitment to support Kenya in terms of strengthening its emergency preparedness and response capabilities.
This week, Uganda reported 1 Ebola case in Mbale district, which is less than 70 kilometers from the Malaba border.
With 1 specific case in Mbale city in eastern Uganda, which is less than 70 kilometers from our border in Malaba. Therefore, the threat of Ebola is real.
Amid the calls for heightened surveillance, Kenya continues to battle the monkeypox disease, with 3 new cases recorded. The 3 cases reported in Busia County now bring the total of confirmed cases to 41. According to the Ministry of Health, since the outbreak of the disease, over 3.3 million travelers have been screened at the points of entry, with 419 samples from suspected cases having undergone testing at the National Public Health Laboratory. Meanwhile, 1 person has succumbed to cholera, while 5 others are hospitalized in Kuria Sub-County, Migori County. The deceased had recently returned from a neighboring county and tested positive.
After admission in the ward, within 2 hours, he passed on, and it was detected that he tested positive from cholera. Thereafter, we started to trace the contacts of the persons who had gotten him to the hospital, and we found out other 5 cases who also tested positive.
Nancy Okware, Easy Friday.